Hi, in today's session we are going to talk about how to approach a short case of external fixator. So for the easiness, we follow a order. There are 6 steps in the examination of external fixator. First, we have to examine the fixator itself. The second one is the joint which had been immobilized. The third one is the infection. We have to look for the infections surrounding the area. Fourth one is we have to measure the bony length measurements. The fifth one is the neurovascular integrity. The last and the sixth one is the regional lymph node. The first one is the fixator itself. So we have to describe the pin count, bars and the fixed place of the external fixator. So for the pin count, we have to tell how many pins are there and whether they are vertical or not. And second, for the bars, we have to tell whether they are interconnected with each other, whether they are perpendicular to each other. And we have to observe the fixator and tell the fixed place of the external fixator. So whether they are fixed to the tibia, whether they are fixed to the bone, the foot bones. Okay. The second one is the joint which had been immobilized. In the first picture, the knee joint had been immobilized. In the second one, ankle joint had been immobilized. The third one is the pin site infection. So you have to look for whether there are signs of infection surrounding the area. So if there is a wound, you can ask to inspect and examine the wound. The fourth one is the bony length measurement. So you have to measure the apparent length and the true length. So the apparent length is you have to measure from umbilicus to medial malleolus. And the true length you have to measure from anterior superior iliac spine to medial malleolus. And you have to comment on this length. The fifth one is the neurovascular integrity. Because fixator itself can damage the neuronal structures, or due to the fracture there can be neurovascular problems, or due to the fracture management, or due to the compartment syndrome. So basically you have to examine the pulse and the capillary refilling time. And lastly, you have to examine the regional lymph node in the area. That is basically a quick summary of what you have to do the examination of external fixator.